Another case here, a part of this study, a patient with resorption of a maxillary canine, and she was actually one of the study patients in the article last year I published with Steve Chu, measuring tissue thickness with dermal apron and a uniaxial implant. And so this patient, again, was very adamant about having a fixed restoration. We had 20 Newton centimeters of insertion torque, which for me is probably average for these types of patients with this type of an implant. An ISQ value is not very high, below 60. But there was no rotational movement of the implant upon taking an impression. We fabricated screw-retained provisional using dermal apron. And at 10 weeks, we take this off. And not only does this provisional restoration physiologically maintain our soft tissue profile, but we have over a 20-point increase in ISQ. Now, with an insertion torque of 20 Newton centimeters, other than taking the back end of a mirror and banging on this temporary to listen for the proper sound, which we know is extremely scientific, what other method do we have to confirm that this implant is integrating or at least moving in the right direction? So ISQ is invaluable for these types of treatments. And so the patient can proceed to having a final cement retained restoration.